Hello, dear students. Welcome back to Learn with Professor Janula. In today's video, we are going to discuss about eclampsia. If you are new to this channel, don't forget to subscribe and press the bell icon to stay updated with the latest videos. Students, listen carefully. Eclampsia is a very serious problem that can occur during pregnancy. It happens in a woman who already has pre-eclampsia, which means high blood pressure with other warning signs. In eclampsia, the woman may develop fits, also called convulsions, or she may even lose consciousness and go into a coma. These fits are not due to epilepsy or any brain disease. They happen only because of pregnancy-related complications. So, simply remember, eclampsia means convulsions or coma in a pregnant woman with pre-eclampsia. This condition is dangerous for both the mother and the baby, so it needs immediate medical care. Now, students, let us understand the incidence of eclampsia. Eclampsia usually occurs after 20 weeks of pregnancy. It does not occur in early pregnancy. Eclampsia can occur at 3 different times. First, antepartum, which means before delivery, during pregnancy. Second, intrapartum, which means during labor. Third, postpartum, which means after delivery. Most commonly, postpartum eclampsia occurs within 48 hours after delivery. So remember this point clearly. Eclampsia can occur before, during, or after delivery, but it is most common after 20 weeks of gestation. Now, students, let us talk about the causes of eclampsia. First, you should remember one important point. The exact cause of eclampsia is not clearly known. However, there are some important factors that contribute to its development. One cause is placental ischemia. This means the placenta does not get enough blood supply, which affects both the mother and the baby. Another cause is endothelial dysfunction. This means the inner lining of blood vessels is damaged, leading to high blood pressure and leakage of fluids. Next is cerebral vasospasm. Here, the blood vessels in the brain suddenly constrict, reducing blood flow to the brain and triggering convulsions. Finally, severe hypertension plays a major role. Very high blood pressure can damage organs and the brain, leading to seizures. So in simple words, poor placental blood flow, damaged blood vessels, brain vessel spasm, and severe high blood pressure together lead to eclampsia. Now, students, let us understand the risk factors for eclampsia. Risk factors mean conditions that increase the chance of developing eclampsia. First is prima gravida. Women who are pregnant for the first time have a higher risk. Next is teenage pregnancy or elderly gravida. Very young mothers and women above 35 years are more prone to complications. A previous history of pre-eclampsia or eclampsia is another important risk factor. If a woman had this problem in an earlier pregnancy, it can occur again. Multiple pregnancy, like twins or triplets, also increases the risk due to increased strain on the body. Now coming to medical conditions. Women with chronic hypertension, meaning high blood pressure before pregnancy, are at higher risk. Diabetes mellitus and renal disease can also increase the chances because they affect blood vessels and kidneys. Obesity is another risk factor, as it is commonly associated with high blood pressure. Finally, poor antenatal care plays a major role. If regular checkups are missed, warning signs may not be detected early. So remember this clearly. First pregnancy, extreme age, previous history, multiple pregnancy, medical illnesses, obesity, and poor antenatal care increase the risk of eclampsia. Now, students, let us understand the pathophysiology of eclampsia step by step. Don't worry, this is very easy if you follow the flow. First, there is abnormal placentation. This means the placenta does not attach properly to the uterus. Because of this, blood flow to the placenta is reduced. Due to poor blood supply, the placenta releases toxic substances into the mother's blood. These substances cause damage to the lining of blood vessels, which is called endothelial damage. Because of this damage, the blood vessels constrict or narrow. This leads to an increase in blood pressure. When blood vessels in the brain constrict, blood supply to the brain decreases. This is called reduced cerebral perfusion. Due to reduced blood supply to the brain, the woman develops convulsions, which leads to eclampsia. Now, students, let us talk about the clinical manifestations of eclampsia, especially the warning signs, which we also call pre-eclampsia signs. These are very important because early recognition can prevent seizures. First, severe headache. This happens due to high blood pressure affecting the brain. If a pregnant woman complains of a persistent, severe headache, it should never be ignored. Next is blurred vision. The woman may say she is seeing spots, flashes of light, or blurred images. This occurs due to reduced blood supply to the eyes and brain. Then comes epigastric pain. This is pain felt in the upper abdomen, just below the ribs. It occurs due to liver involvement and stretching of the liver capsule. Now let us look at the signs related to fluid balance. Oliguria means passing very little urine. This happens because blood flow to the kidneys is reduced. Sudden weight gain is due to fluid retention, not fat gain. Similarly, pedal edema, or swelling of the feet, occurs due to leakage of fluid from blood vessels. Finally, proteinuria. This means protein is present in the urine, indicating kidney damage. So remember, students, these warning signs are the body's way of telling us that eclampsia may develop soon if not treated. Early detection and timely management can save both mother and baby. Now, students, let us understand the signs of eclampsia. These are emergency signs and indicate that the condition has become severe. The most important sign is convulsions, also called tonic-clonic seizures. During a seizure, the body becomes stiff first, and then shows jerky movements. This happens due to severely reduced blood supply to the brain. Next is loss of consciousness. After or during the seizure, the woman may become unresponsive and not react to stimuli. Hypertension is always present. The blood pressure is very high, which triggers seizures and damages vital organs. You may also notice frothing at the mouth. This occurs due to excessive salivation and difficulty in swallowing during convulsions. Cyanosis is another sign. The lips, nails, or face may appear bluish, indicating lack of oxygen. In very severe cases, the woman may go into coma. This means prolonged unconsciousness due to severe brain involvement. So remember, students, convulsions with hypertension in a pregnant or recently delivered woman strongly suggest eclampsia and require immediate medical attention. Now, students, let us talk about the investigations done in eclampsia. These tests help us confirm the diagnosis, assess severity, and monitor both mother and baby. First, blood pressure monitoring. Blood pressure is checked frequently because high BP is the key problem in eclampsia. Next is the urine test for protein. The presence of protein in urine shows kidney damage, which is common in pre-eclampsia and eclampsia. Then we do a complete blood count. This helps us assess hemoglobin levels and platelet count. Low platelets may indicate severe disease or HELP syndrome. Liver function tests are done next. These tests detect liver involvement, especially when the woman has epigastric pain. Now coming to renal function tests. These check how well the kidneys are working, since reduced urine output is common. Serum electrolytes are checked to monitor fluid and electrolyte balance, especially when magnesium sulfate is given. Finally, we must always monitor the baby. So we do fetal monitoring, such as NST and ultrasound, to assess fetal well-being and growth. So remember, students, investigations in eclampsia help us protect the mother, monitor organ function, and ensure fetal safety. All right, students, now let us understand the management of eclampsia, focusing on immediate or emergency care. When a woman with eclampsia is brought to the hospital, our first priority is to save her life. Delivery is not the first step. Stabilization comes first. We always start with the ABC principle, which means airway, breathing, and circulation. The airway must be kept clear so that the woman does not choke on saliva or vomit. We observe her breathing carefully and ensure she is getting enough air. At the same time, we check circulation by monitoring pulse and blood pressure. Next, the woman should be placed in the left lateral position. This position helps prevent aspiration, improves blood flow to the uterus, and reduces pressure on major blood vessels. During convulsions, it is very important to protect the woman from injury. We should not restrain her forcefully. Instead, we remove nearby hard or sharp objects and provide padding if possible to prevent trauma. Oxygen is administered to improve oxygen supply to both the mother and the fetus and to prevent hypoxia. If there is frothing or excessive secretions in the mouth, gentle suction is done to keep the airway clear and reduce the risk of aspiration. So remember, immediate management of eclampsia is all about maintaining airway, breathing, and circulation, positioning the woman safely, preventing injury, and ensuring adequate oxygen. Once the woman is stable, further treatment like medications and delivery can be planned. All right, students, now let us understand the drug management of eclampsia. In eclampsia, medicines are mainly given for two important reasons. One is to control and prevent seizures, and the other is to control very high blood pressure. First, let us talk about anticonvulsant drugs. The drug of choice in eclampsia is magnesium sulfate. This is the most important medicine and is asked very frequently in exams. Magnesium sulfate works by controlling active convulsions and preventing further seizures. It relaxes the muscles and reduces excessive brain activity that causes fits. It is safer and more effective than other anticonvulsants when used correctly. While giving magnesium sulfate, nurses must always monitor respiratory rate, urine output, and deep tendon reflexes to prevent toxicity. Next, we come to antihypertensive drugs. These drugs are used because very high blood pressure can lead to complications like stroke, placental abruption, and organ damage. One commonly used drug is labetalol. It helps to lower blood pressure smoothly without affecting blood flow to the placenta. Another drug is hydralazine, which works by relaxing blood vessels and reducing blood pressure quickly in emergency situations. Nifedipine is also used. It is usually given orally and helps in controlling blood pressure by relaxing the blood vessel walls. So remember, students, in drug management of eclampsia, magnesium sulfate is the key drug for seizures, and antihypertensive drugs like labetalol, hydralazine, and nifedipine are used to control blood pressure. All right, students, now let us understand obstetric management of eclampsia. This is very important for exams and clinical practice. In eclampsia, the first and most important step is to stabilize the mother. We do not rush into delivery immediately. The mother's life always comes first. Her airway, breathing, circulation, blood pressure, and seizures must be controlled before taking any obstetric decision. Once the mother is stabilized and her condition is under control, the next step is to plan for early delivery, because eclampsia is a pregnancy-related condition and the definitive treatment is delivery of the baby and placenta. Now, the mode of delivery is not the same for all patients. It depends on a few important factors. One factor is the gestational age of the pregnancy. Another factor is the cervical dilatation, meaning whether the cervix is favorable for vaginal delivery or not. The third and most important factor is the condition of the mother and the fetus. If the mother is stable, the fetus is doing well, and the cervix is favorable, vaginal delivery may be planned. If the mother's condition is severe, seizures are not controlled, the fetus is in distress, or the cervix is unfavorable, cesarean section may be required. So remember, students, in obstetric management of eclampsia, first stabilize the mother, then plan early delivery, and finally decide the mode of delivery based on gestational age, cervical status, and maternal and fetal condition. All right, students. Now let us understand nursing management of eclampsia during convulsions. Imagine you are at the bedside of the patient. When a woman develops convulsions, the nurse should never leave the patient. Staying with the patient is very important because seizures can be life-threatening, and the nurse's presence itself ensures safety and quick action. During the convulsion, gently turn the patient's head to one side. This helps prevent aspiration of saliva, vomitus, or secretions and keeps the airway clear. You should never restrain the patient forcefully. Forceful restraint can cause fractures, muscle injury, or trauma. Instead, allow the seizure to pass while protecting the patient from harm. Also remember, do not insert any object into the mouth. This can break teeth, injure the mouth, or block the airway. The old practice of putting objects in the mouth is unsafe and should be avoided. While all this is happening, the nurse must ensure safety and privacy. Remove nearby hard or sharp objects, loosen tight clothing, and maintain dignity by providing privacy. So students, during convulsions, the nurse's role is mainly protection, observation, and reassurance, not forceful intervention. These simple but critical actions can save the life of both the mother and the baby. All right, students, now let us talk about nursing care after convulsions. Imagine the seizure has stopped and the patient is entering the recovery phase. After the convulsion, the first priority is to maintain the airway. The patient may still be drowsy or unconscious, so keeping the airway clear is very important to prevent aspiration and ensure proper breathing. Next, the nurse should check the vital signs: blood pressure, pulse, respiration, and temperature. This helps us assess how stable the mother is after the seizure and detect any complications early. Once the mother is stabilized, we should monitor the fetal heart rate. During convulsions, the baby may experience stress due to reduced oxygen supply, so fetal monitoring is essential to assess fetal well-being. Then, administer all prescribed medications as ordered by the doctor. This usually includes magnesium sulfate to prevent further seizures and antihypertensive drugs to control blood pressure. Finally, the nurse must record intake and output very strictly. This is extremely important in eclampsia because kidney function may be affected and fluid overload can be dangerous. Accurate documentation helps guide treatment and prevent complications. So remember, students, after convulsions, nursing care focuses on observation, monitoring, medication administration, and accurate recording. Calm, systematic care at this stage plays a major role in saving the life of both mother and baby. All right, students, now let us understand monitoring in eclampsia. In a patient with eclampsia, continuous and careful monitoring is extremely important because her condition can change very quickly. First, we regularly monitor the blood pressure. High blood pressure is the main problem in eclampsia, so frequent BP checking helps us know whether treatment is effective and prevents complications like stroke. Next, we observe the respiratory rate. This is especially important when the patient is receiving magnesium sulfate. If the breathing becomes slow, it may indicate magnesium toxicity, which is dangerous. Then, we closely monitor the urine output. The minimum acceptable urine output is 30 milliliters per hour. This tells us that the kidneys are functioning well and that magnesium sulfate is being safely excreted from the body. Another very important aspect is checking deep tendon reflexes, such as the knee jerk. Magnesium sulfate depresses reflexes, So absence of reflexes can be an early warning sign of magnesium toxicity. Finally, the nurse must always watch for signs of magnesium toxicity. These include absent deep tendon reflexes, slow breathing, decreased urine output, and extreme drowsiness. Early identification of these signs can save the patient's life. So remember, students, monitoring in eclampsia is continuous, systematic, and life-saving. As nurses, your careful observation plays a crucial role in preventing complications for both mother and baby. All right, students, now let us clearly understand magnesium sulfate toxicity. Magnesium sulfate is the drug of choice in eclampsia, but if it is given in excess or if the kidneys are not working properly, it can lead to toxicity. That is why nurses must be very alert. The first and earliest sign of magnesium sulfate toxicity is absent knee-jerk reflex. This is why checking deep tendon reflexes is so important during treatment. Next, the patient may develop respiratory depression. This means the breathing becomes slow and shallow. If this is not identified early, it can become life-threatening. Another warning sign is decreased urine output. When urine output reduces, magnesium is not excreted properly from the body, leading to accumulation and toxicity. In very severe cases, magnesium sulfate toxicity can cause cardiac arrest, which is a medical emergency. Now remember this very important point for exams and clinical practice. The antidote for magnesium sulfate toxicity is calcium gluconate. It should be kept ready at the bedside whenever magnesium sulfate is administered. So students, always remember, no reflex, no respiration, no urine. Think magnesium toxicity and act immediately. All right, students, let us now talk about prevention of eclampsia. Prevention of eclampsia mainly depends on good antenatal care. When a pregnant woman comes for early and regular antenatal checkups, problems like high blood pressure and protein in urine can be detected early. Early detection and proper management of preeclampsia is the most important step. If preeclampsia is treated on time, we can prevent it from progressing to eclampsia. Proper nutrition during pregnancy also plays an important role. A balanced diet helps in maintaining overall maternal health and reduces complications. Regular blood pressure monitoring during pregnancy is essential. It helps in identifying hypertension early and starting treatment before complications occur. Finally, patient education is very important. Pregnant women should be taught about warning signs such as severe headache, blurred vision, swelling of face and hands, and reduced urine output. If they recognize these symptoms early and seek medical help, eclampsia can be prevented. So, students, remember this key message: early care, early detection, and patient education are the pillars of preventing eclampsia. All right, students, now let us discuss health education in eclampsia. Health education plays a very important role in preventing complications like eclampsia. First, pregnant women must understand the importance of regular ANC, antenatal, visits. These visits help in checking blood pressure, urine, and overall health of both mother and baby. Regular checkups help doctors and nurses detect problems early. Next, women should be advised to take a diet rich in protein. Protein helps in tissue repair, improves maternal health, and supports fetal growth. Foods like milk, eggs, pulses, fish, and nuts should be encouraged as per availability. Adequate rest is equally important. Pregnant women should avoid overwork and get enough sleep. Proper rest helps in controlling blood pressure and reducing stress on the body. Women should be clearly taught to report danger signs immediately. These include severe headache, blurred vision, swelling of face or hands, epigastric pain, reduced urine output, or fits. Early reporting can save the life of both mother and baby. Finally, medication compliance must be emphasized. If medicines are prescribed for blood pressure or prevention of seizures, They must be taken exactly as advised. Skipping medicines can lead to serious complications. So students, remember, good health education empowers the mother, improves compliance, and prevents eclampsia-related complications. Thank you for watching this video. If you found this content helpful, please like the video, share it with your friends, and leave your thoughts in the comments section. Don't forget to subscribe to our channel and turn on the notification bell for more nursing and medical learning videos. Your support helps us create better educational content. Thank you.